This video is going to be answering a recent viewer question about what to do if you have this constant feeling of a knot being in your stomach, or if you can't stop thinking of things going wrong, or if things already have gone wrong. As a licensed anxiety therapist, I hear about these two things so much. So I wanted to provide a little bit more of a detailed explanation for how I might approach this if I were to hear something like this come up in a session. And for reference, I do tend to lead towards an acceptance and commitment therapy type approach to anxiety, so just keep that in mind as we go through this. And of course, I want to give a bit of a disclaimer before we really dive into it. Anything that I say or suggest here is a very general approach. I don't know the intimate details of any of your situations. Consulting your doctor or therapist is always going to be the best bet going forward, because they more so know the intimate details of the situation, and they're going to be able to help you decide whether or not any of these approaches that either I'm saying or any other therapist on any social media site is going to say, to see if they are going to be a good fit for your particular situation. So that's why we always say consult with your doctor or therapist. Now, first things first, let's just put a name to this experience. The constant feeling of a knot being in your stomach, or even feeling anxious, paired with those worst case scenario types of thoughts, or just thinking that things have already gone wrong or definitely will go wrong, can be labeled as anxiety. Now, do not take this as a diagnosis, because it's not meant to be one. These are just two of the most common experiences that come up for those of us who do tend to struggle with anxiety on a regular basis. Now let's get into the why. Anxiety at its core is a nervous system response to a potential threat. This could be a real threat, like a life or death situation. This could be a perceived threat, something that we feel is dangerous or believe is dangerous, but is not an actual danger to our well-being or our survival. Regardless of if it's an actual threat or a perceived threat, our brain, our body, our nervous system responds in the same way. And when our brain and our body identifies any possibility of threat, it turns on our sympathetic nervous system, which in essence is our protective mode. And this protection mode comes with a whole host of physiological changes within your body. It's also important to note that this protection mode can and will switch on, whether it's that actual danger or it's that perceived danger. This means that we can start to feel a lot of fear and anxiety and bodily changes and discomfort, even if we're not actually in danger. So when you start to get like a knot in your stomach, or you start feeling nauseous because of anxiety, because your brain has identified some type of threatening situation, when this starts to happen, this is because digestion actually slows down when our body is in that protection mode. Digestion is kind of seen like an unnecessary use of resources when our lives are truly in danger. So the body tends to shut down these unnecessary resources like digestion and even reproduction if our lives are truly in danger. So it can really devote all of its energy and resources to more life-saving processes, like increasing blood flow to our brain and our muscles so we can think and run away. Which kind of leads us to that other very common anxiety experience, which is thinking about worst case scenarios, or thinking that things already have gone wrong. This type of thought process is the brain's way of trying to problem solve when it believes it's in danger. It's going to hyperfixate on worst case scenarios because it's trying to predict what could go wrong, so it can then think of solutions before things go wrong. Sometimes this can look like replaying conversations or scenarios, or even creating completely made up situations or conversations in our mind that are likely never going to happen. And remember back to when I said our sympathetic nervous system or our anxiety protective response turns on even with perceived situations. When we are in a problem-solving mode, when our brain is thinking about worst case scenarios or creating those situations in our mind, our brain responds to these conversations as if they are actually happening. So we can kind of get ourselves into this vicious anxiety cycle where our sympathetic nervous system switches on. So we're already in a heightened state. We kind of start thinking of those problem-solving situations and thinking of the worst case scenarios. And then we're also kind of having an anxious response to those scenarios that we're creating in our mind. And we just kind of get into this anxious spiral. So All that to say, if you've been experiencing any of these things recently, here are a few approaches that could be really beneficial for you. And again, always consult your doctor or your therapist before applying any of these practical strategies. The first is when you start to notice these experiences, take a minute to just pause and acknowledge that this is an anxiety response, that the brain and the body are feeling unsafe for some reason. So we can label this, we can call this out and just acknowledge, okay, I'm feeling unsafe right now. Maybe I know why, maybe I don't know why. The why doesn't really matter here. Acknowledging the fact that our body does not feel safe can go such a long way in just normalizing this experience for ourselves. And as we normalize it, anxiety then doesn't feel as dangerous. We can kind of remove ourselves from that vicious anxiety cycle that I was talking about earlier, because we are acknowledging that, okay, I'm feeling unsafe, and we can just kind of leave it at that. The second is to rate your anxiety on a scale of 0 to 10. 0 being zero anxiety, no anxiety at all, and 10 being the most anxiety you've ever experienced or could ever imagine experiencing. Noticing where your anxiety falls on this scale is going to be helpful eventually to kind of figure out the best course of action for helping your mind and your body feel safe again. Oftentimes, the lower anxiety is on this scale, the more manageable it feels, and that's where more cognitive approaches can be really beneficial, because we can still kind of think our way through these situations. Whereas when anxiety is much higher on the scale, we can't really think ourselves out of anxiety. That connection is severed. And I talk a little bit more about that in some other videos that I will link here. But just for the purpose of this video, just know that we cannot think ourselves out of anxiety. And that's where more breath work and somatic therapies can come into play. Kind of that grounding, body-based work can really be helpful here. And honestly, the more cognitive approaches are probably going to make your anxiety a lot worse when you're already in a really heightened state, like a 7, 8, 9 on that scale. Once you get an idea of where your anxiety is falling, then it's time to kind of work and figure out, how am I going to make myself feel safe here? And this is a step that honestly takes patience, trial and error to figure out what feels best in your body for wherever you're falling on that scale. Maybe it's journaling, maybe it's taking a walk, maybe it's meditation or chatting with a friend, maybe it is going through those breathwork strategies or somatic grounding types of strategies. There's no one quick fix for anxiety because it is a protective response. So we really just have to figure out, how am I going to best care for myself within this particular situation? How do I let my brain know that I'm safe when it's not feeling safe? Another important thing to know for this kind of part in the process is the intention behind these strategies are really what make the most impact here. If we are using any type of coping strategy, whether it's for anxiety or anything else, if we're going into that coping strategy with the sole intention of eliminating our discomfort, it's likely not going to work for you. And I'll put work in quotation marks, because when we say, oh, that didn't work for me, usually what we mean is it didn't get rid of my emotion, or it didn't get rid of that scary thought. But that's not necessarily the goal, because it's not realistic to get rid of our emotions or to get rid of our thoughts. What is realistic and what is going to work long term is changing how you're responding to the anxiety, to the emotion, to the thoughts, and going into that response with the intention of just creating safety and caring for yourselves well. And this is something that we can do in the moment when we're experiencing anxiety or any other type of distress. And it's also something we can do proactively, especially in the case of anxiety. We can go through different calming activities and kind of schedule them into our day. So we have these intentional times where we're moving our body from that sympathetic state that it's probably already in because the day gets crazy, and we're able to move ourselves into a parasympathetic state. This proactive approach is known as relaxation training, and this is essentially where we're just scheduling in calming activities or relaxation types of activities into our day and into our week, so we have that time set aside where we're helping our brain and our body feel safe. And this type of proactive approach also helps to regulate your nervous system. So as you continue doing this in the future, your nervous system is going to be able to kind of get back into that parasympathetic, calm, relaxed state much faster because it's had practice doing so. It knows how to kind of get back there. Okay, so I hope that this has been kind of helpful for you guys, for anyone who's been experiencing these two anxiety experiences in particular. And as always, please feel free to, ask questions or ask for clarifications down in the comments, or even shoot me an email. I am just coming off of maternity leave, so it might take me a little bit longer to get to some of those questions or clarifications, but I promise I will do my best in answering those for you and making other videos like this to answer them in a more detailed way. And thank you again for this question. I hope it's been helpful for you, and I will see you guys next time.